Good morning, everyone. Welcome to Health Talk with Dr. D, where we break down medical topics in a way that's clear, real, and easy to understand. I'm Sabrine, your host. Today, we're talking about a condition that affects over 1 million people in the U.S. and continues to change lives worldwide, HIV. We're joined by Dr. D, a specialist in infectious diseases, and Savati, who is here to share a personal perspective. Thank you both for being here.
Thank you for having me. I'm honestly still learning about HIV myself.
Happy to be here. There's a lot of misinformation out there, so this is a great opportunity to set the record straight.
So, Dr. D, let's start with the basics. What exactly is HIV?
HIV stands for a human immunodeficiency virus. It is a virus that weakens your immune system by targeting white blood cells called CD4 and T helper cells, the very cells that help your body fight off infections.
Wait, so HIV doesn't make you sick directly?
Right. HIV doesn't cause illness in the same way the flu or COVID might. Instead, it slowly destroys your immune defenses. If untreated, it can lead to AIDS or acquired immunodeficiency syndrome, where your body can fight off even minor infections.
How does HIV do that? What's going on inside the body?
The name HIV almost always refers to HIV-1, the more virulent and infective type. The human immunodeficiency virus, or HIV, targets cells of the immune system. When the immune system starts to fail, this is termed immunodeficiency. In the final stage of the disease's progression, a patient is said to have acquired immunodeficiency syndrome, or AIDS. AIDS is not the virus, but rather a set of symptoms that result from the virus. It is defined as either having a T-cell count below 200 cells per millimeter cubed of blood, or as having HIV and at least one opportunistic infection associated with AIDS, regardless of T-cell count. An opportunistic infection is an infection caused by pathogens that would normally not be a problem, but which take advantage of an opportunity, such as a compromised immune system. HIV targets CD4 positive cells, in other words, cells that bear the CD4 glycoprotein on their membrane, such as regulatory and helper T cells, monocytes, macrophages, and dendritic cells. CD4 is a co-receptor of the T cell receptor, allowing T cells to communicate with antigen-presenting cells such as dendritic cells. In order to understand how HIV impacts the immune system, we must first understand the difference between innate and adaptive immunity. The innate immune system consists of generalized barriers to pathogenic invasion. This includes physical barriers like your skin, cell-destroying stomach acid, the inflammatory response, and cells like macrophages, neutrophils, and mast cells that recognize molecules common to pathogens. Meanwhile, the adaptive immune system brings out pathogen-specific weaponry. This response is thanks to B and T cells, which recognize antigens, bits of a pathogen that allow for its recognition. When dendritic cells, a type of antigen-presenting cell on the bridge between the innate and adaptive immune systems, enter lymph nodes, B cells produce antibodies to bind the specific invader, marking it for destruction by other cells. There are 4 kinds of T cells, and the relevant ones here are cytotoxic and helper T cells. Cytotoxic T cells bind and lyse the pathogen. Helper T cells are necessary for the activation of both cytotoxic T cells and B cells, so without them, the adaptive immune response can't be activated. Antibodies don't get produced, and infected cells aren't lysed. Unfortunately, helper T cells are CD4 positive, and the main target of HIV. As the infection progresses, there is a substantial loss of these cells. The immune system fights back by producing more T cells, some of which differentiate into helper T cells. This fight for supremacy continues for years, until the virus eventually tips the scales. The body loses its ability to produce T cells, and even the weakest pathogens become problematic.
When HIV enters the bloodstream, it finds a CD4 cell and fuses with it. Then it hijacks the cell's machinery to copy itself. Here's a step-by-step breakdown.
Let's go through the HIV life cycle. In step 1, an HIV virus in the bloodstream attaches and binds to a CD4 cell's receptor. In step 2, the HIV virus fuses with the CD4 cell's membrane and releases its contents into the cell. For step 3, reverse transcriptase takes the single-stranded HIV RNA and reverse transcribes it into double-stranded DNA. Then, for step 4, the newly made double-stranded DNA is then integrated into the cell's DNA using the integrase enzyme. In step 5, when this infected cell divides, the cell's DNA is replicated, including the inserted viral DNA. In step 6, the cell now makes and assembles proteins following this genetic code, including the viral proteins coded for by HIV. Step 7 is called budding, when the virus leaves a cell and takes some cell membrane with it. Step 8 completes the cycle.
So my immune system doesn't get weaker over time without me knowing, or does it?
Exactly. That's why early testing and treatment are so important.
So, Betty, do you mind sharing what made you get tested?
Yeah, so I had a really bad fever and a sore throat, and I thought it was the flu. Then I had swollen lymph nodes, and I was starting to get a rash, so I would go get checked just to be safe, and they suggested that I got tested, and that's when I found out.
That's a common early stage of HIV. Flu-like symptoms a few weeks after exposure, then it enters the latency period where people may feel totally fine for years, but HIV is still working in the background.
What happens as it progresses?
Without treatment, HIV can lead to AIDS. People may start getting frequent infections like pneumonia or tuberculosis, chronic diarrhea, extreme weight loss, skin lesions from cancer, even memory loss or confusion from HIV-associated neurocognitive disorders.
So it doesn't just affect the immune system?
Right, it affects multiple systems. Immune system weakens ability to fight infections, GI systems, diarrhea, malnutrition, respiratory, increased risk for TB, pneumonia, skin, lesions, and rash, neurological confusion, forgetfulness, sometimes depression or anxiety.
Yeah, and I started feeling really tired all the time, and I had some really bad memory problems, and I didn't even think that was related.
So for nurses caring for patients with HIV, what should they be looking for during a hepatitis assessment?
Great question. Here are key things nurses should assess. Vital signs, especially fever, which can be an infection. Oral cavity, looking for thrush, mouth sores, skin rashes, lymph nodes, are they swollen or tender? Lungs, listen for crackles or signs of a respiratory infection. GI health, ask about nausea, vomiting, or diarrhea. Do a neural check, any signs of confusion or fatigue, and unexplained weight loss.
Oh, okay. Yeah, my nurse was super thorough with me, and she explained everything and made me feel safe and not judged, so that meant a lot to me.
This was so informative, Dr. D. Thank you so much. Any last thoughts for your viewers?
HIV is serious, but it's no longer a death sentence. With antiviral therapy, people with HIV can live long, healthy lives. The key is early detection and consistent treatment and compassion from healthcare providers.
I agree. I was scared at first, and now I'm learning, managing it, and living my life.
Thank you both so much for sharing your knowledge and your experience. And thank you for watching Health Talk with Dr. D. Until next time, stay informed and take care. Now, after the break, we're going to be asking a member in the audience a few questions. Welcome back to Health Talk with Dr. D. Now let's turn it over to the audience, and we have a member in the audience who has a few questions for Dr. D.
Okay, so Dr. D, I have a couple questions.
Okay.
Is HIV the same as AIDS?
No, HIV is the virus. AIDS is the final stage of HIV if left untreated.
Okay. Can HIV be spread through kissing or sharing food?
No, good question. HIV is spread through saliva or casual contact. It spreads through blood, semen, vaginal fluids, and rectal fluids, and breast milk.
Okay, so what does HIV actually do inside the body?
It attacks the immune system.
Okay. How long can someone have HIV and not know it?
Sometimes years. That's why testing is so important.
Oh, wow. What are the first signs someone might notice?
Fever, rash, sore throat, fatigue, like the flu.
Okay. And does HIV only affect the immune system?
No, it affects many systems, including skin, GI, lungs, and even the brain.
Why do people with HIV get infections so easily?
Because HIV weakens the immune system, especially the CD4 cells that fight off viruses and bacteria.
How can nurses make HIV positive patients feel more supported?
Use non-judgmental communication, explain each step clearly, and provide education and empathy.
Sounds good. Can people with HIV live normal lives?
Absolutely. With art, people can live long, healthy lives and even have families.
And is there a cure for HIV?
Not yet, but treatments are highly effective at suppressing the virus.
I'm here with the audience and I'm gonna ask them some bonus questions. So, my first question is, what surprised you about HIV today?
So what surprised me about HIV today was just the disease itself. I knew it would attack the immune system pretty quickly, but I wasn't really sure that it could stay in the body for as long as years. That was very surprising to me, how people would not, know how long it would be in their body for. So it's important to get tested, guys.
All right, so my next question is, how would you support a friend or a patient who's not newly diagnosed?
First of all, I wouldn't judge the friend or the patient. I would make sure to be as communicative as possible and also hear them out. I would also refer them to any specialists around the area that I know and to just help them become more comfortable in their skin.
Okay. All right, my last question. What role do you think nurses should play in ending the stigma around HIV?
The role I think that nurses should play is, again, be very nice to the patients, make sure the patients are very comfortable around them, and also just have a good, well-mannered attitude around the patients, and also make sure that their environment that they're in is safe and secure, and that they wouldn't feel judged or persecuted for having this disease.
Okay, perfect. That concludes our bonus questions. All right, that concludes our show today, Health Talk with Dr. D. If you have experiencing these symptoms, please go get checked out and go get tested. Don't feel ashamed. Until next time, bye.